Good morning. My name is Mariana Guerrero, and these are my teammates.
I'm Hannah Castillo.
I'm Nicole Mendenhall.
And I'm Robin Pingle.
On January 21st, a Washington state resident became the first confirmed case of the coronavirus in the United States. From then on, life has been changed in unthinkable ways. However, not all citizens face equal experiences. African Americans have been disproportionately impacted by COVID-19 in 2020. As can be seen on the graph, African Americans account for 74 deaths by COVID per 100,000 Americans, while white people account for only 30 deaths per 100,000 Americans, which is less than half. And these disparities have been caused by numerous factors, one being underlying socioeconomic issues in African American communities in the United States. So, to what extent has African American socioeconomic standing in the United States affected the impact COVID-19 has on African American communities in the year 2020?
And the claim to that previous question is that African American socioeconomic standing in the United States has contributed to the disproportionate impact of COVID-19 on African American communities. To start, in the US, a stimulus check was sent out for $1,200 in April of 2020. However, not everyone received it because of unbanked accounts. Unbanked means a person without a bank account. This person here is Congressman Gregory Meeks from New York, and in an interview from the New York Amsterdam News in April of 2020, he says that, quote, "Unless you have a bank account where the check can be directly deposited into the bank, you have to wait another 4 to 6 weeks before the paper checks will get into the mail." And in this quote, he's advocating for stimulus checks to be delivered on time, whether citizens are unbanked or not. And these checks can be delivered through the mail rather than the bank, because without them, it creates a domino effect, which leads to underfunding of businesses and families, which can be shown here. Working from home leads to a decrease in customers, which leads to underfunding. Author Alana Abramson mentions in a Time article that, quote, 12% of them received the full assistance they requested, with 2/3 reporting they did not receive any. This graph here shows data from the University of California comparing business owners of different races. At the top, 17% of white business owners stopped working during the pandemic, and at the bottom, 41% of Black business owners stopped working. And they've been affected the most by any other race because of government actions such as the slow delivery of stimulus checks.
And as can be seen on this graph, both the underemployment and unemployment rates for Black people were higher than that of white people, which was only increased by the COVID-19 recession, which can be seen by the gray area of the graph. This mass loss of income contributed to the already increasing wealth gap between African Americans and white Americans. The Federal Reserve reported that in the second quarter of 2020, white households, who account for 60% of the United States population, held 84% or $94 trillion of total household wealth in the United States, while comparatively Black households, who account for 13.4%, held only 4% of total household wealth, which is around $4.6 trillion. A combination of poor to no income and limited financial opportunities due to historically poor infrastructure is what contributes to this gap in wealth. This poor infrastructure was caused by a multitude of issues, one being redlining. In the 1930s, redlining was this process where government surveyors rated neighborhoods: green for best, blue for still desirable, yellow for definitely declining, and red for hazardous. Red-lined areas were discounted as credit risks, usually because of the residents' racial and ethnic demographics. This process only ended in 1968 when the Fair Housing Act of 1968 was passed, which prohibited the discrimination off of race, religion, sex, or origin when concerning the sale, rental, or financing of homes. And so redlining created a gap in wealth between African American and white communities. Without the deemed reliable credit, they would apply for quality housing and services. And so overall, their communities and infrastructure declined and became underfunded, which still affects
Because of issues with socioeconomic status, African Americans are more likely to struggle with receiving a high-quality education. The graph here shows how one of the major obstacles for Blacks is less access to good schools. High-quality education often leads to better jobs, higher income, and an overall healthier lifestyle. Evidently, African Americans are less likely to experience these benefits. Another example of how education affects health is the issue of educational expenses. Because African Americans are more likely to experience low income, paying expenses such as tuition and debt can be difficult. As a result, many Black college students turn to applying for jobs, and the jobs that are the most available are the ones that put them on the front line. This chart here shows how Black Americans are overrepresented in low-wage frontline essential jobs, and being on these frontline jobs increase their risk and exposure of contracting COVID. Furthermore, low socioeconomic status also inhibit African Americans from accessing sufficient healthcare resources. The graph on the left shows how African Americans experience higher poverty rates than the nation as a whole. Poverty and low income makes it hard for individuals to pay necessary expenses like health insurance. The graph on the right shows how Blacks are more likely to not be medically insured. This is a problem because without medical insurance, getting treatment for diseases such as COVID is very slim. According to this graph by the Economic Policy Institute, it has been found that African Americans are more likely to have pre-existing health conditions that make them more vulnerable to COVID. Underlying conditions such as asthma and diabetes have been found to worsen COVID symptoms, thus resulting in a higher infection and fatality rate. While genetics are an important factor in the development of these diseases, a fair number of these conditions also stem from external factors such as racism.
African Americans are struggling to stay safe because due to all the racism they receive, they're already entering the pandemic with a higher risk to the virus. They don't have access to good quality necessities they need to be able to survive this pandemic due to all the racism they have had to live with for decades. This chart shows how African Americans are affected by COVID-19 more than white Americans. Minority groups have such a disadvantage to COVID. They aren't able to receive as much attention to them and their health as whites are. The African American community is more likely to contract COVID-19 due to them being unable to get good quality health care because of the color of their skin. Medical anthropologist Clarence Gravel says if Black people were dying at the same rate as white Americans, at least 13,000 mothers, fathers, daughters, sons, and other loved ones would still be alive. This chart shows that more people who are Black are dying to the virus. They haven't been given the necessities they need to survive. Most African Americans can't even afford to be able to get the health care they need due to their low-paying jobs, meaning if they are taken to a hospital, employers will most likely handle people with money as a priority. In New York City, skin color helps determine where a patient receives hospital care. This is unfair treatment that Black Americans have to deal with.
A possible solution to all the things mentioned in the other slide is to provide stimulus checks to all low-income families. That way, African American families can receive the money they need without targeting one specific race. However, the limitation to this solution is that it does not address the root problem, systemic racism, because systemic racism is not just a cause of COVID. It was caused by years and years of discrimination and false stereotypes of African Americans.
A resolution would be to make the conditions for the stimulus check more rigorous and to benefit the people who are truly in need, which are commonly African Americans, such as people who have had more children, make low income, and live in poor communities. They should be getting the most benefit. In addition to stimulus checks, the federal and local government must invest money into African American communities to improve infrastructural overall helping services such as healthcare, housing, education, and food services. Do you have any questions for us?
I do have a question for each one of you.
Okay.
There we go. Whoever's sharing the screen, you can stop sharing. And then the first question is going to go is to Nicole. Nicole, how did the content of your presentation change as you went through this process and you talked about it?
Well, the content changed because our overall topic, we were mostly talking about African Americans and how it has affected them. But we changed it to social economic factors that contributed to the impact of African Americans going abroad to apply to everybody.
All right, thank you. Hannah, you get the next question.
Okay.
In the future, what changes would you make to your group norms and how would that improve your overall presentation?
In the future, we would make a more reasonable schedule and have more group check-ins to measure progress, because that way we could work together better as a team and keep everyone on task, such as getting stuff in on time.
Okay, thank you. Mariana, you're up next. In what way did you improve your ability to work with a group as a result of this project?
I improved my ability to work with a group by definitely improving communication. With this group, we were more active in our group chat and we were more active with FaceTiming and talking to each other, collaborating with our papers and presentation.
All right, thank you. And Robin, that leaves you for the last one. What's the strongest counter argument to your solution?
The stronger counter argument to the solution was the first solution where we didn't address the root cause of the problem, which was racism. And essentially, that counter argument kind of shows how that solution would have been a temporary fix to a long withstanding problem of racial prejudice.